and I will say, I think it's important to point out, we are the largest bilateral donor to global health and will continue to be under the President's request. And as to the issues you raised forcefully, and you and I have spoken many times, and you're very passionate, obviously and understandably, on this cause. The new report will be coming out in a matter of weeks. We think it should be out in the month of May to address some of the issues and questions that you've raised. As we promised you we will. We were delayed, quite frankly, because of the lapse in appropriations, but that should be coming forward to you soon so that we'll have the facts and be able to take a look and see what some of the impacts and effects have been. Obviously, our obligation is where a partner does not agree to the conditions, the standard language through PLGHA, is to provide a transition and minimize disruption. That's what we have been undertaking. In terms of some of the numbers that you raised, we'll make sure that we get to you those numbers and have a briefing with you to make sure that we have addressed the questions that you've raised.
I appreciate that. I understand that under the new policy that Secretary Pompeo has announced, that not only are the foreign NGOs who receive U.S. funding required to comply with the policy, but they're expected to police their partners and their partners' partners while ensuring their own compliance. So is that correct? And is USAID doing anything differently to help them provide the information that is required?
Two parts to that. First, the latter part of it, in line with the Secretary's announcement, we are working with state to finalize both frequently asked questions and what the standard language looks like. But as to the first part of it, this part of the Secretary's announcement does not reflect a change in policy. It is the same policy that was in existence, say, last year. There are a couple of other minor changes that were announced that actually don't touch upon those issues. But in terms of the underlying issue of the follow-on sub-grantees, that's actually not a change in policy. It is consistent with the policy last year.
But I guess that doesn't get at my underlying question, which is, are the NGOs who receive assistance required to police the partners that they do business with? How is that information relayed to USAID? And what is USAID doing to help them with how to figure out how to police this?
So again, it's actually not a change in policy. What it does require is a certification. It does require in the standard language that they agree to its provisions. In terms of reporting...
I'm sorry to interrupt, but let me just be clear. And the certification requires not only that they comply with the expanded policy, but that any partner that they're doing business with, they are required to ensure that they're complying as well? It
is, again, clarifying existing policy that any organization which receives funding subject to PLGHA is not providing support to any foreign organization that provides abortion services or counseling. So it's actually not a change in policy. As to the impacts, when we did the first report that we gave to you and briefed you on, as you know and as you pointed out, that was 6 months into the policy, and so we had relatively modest data at that point. We now obviously have much more time that we're looking at. And in terms of what the consequences and numbers are, what its effects have been, that's what we'll be able to report to you in May. And I will say, in terms of actual numbers and organizations involved, that's actually what is in the final stages of the report that's being prepared, that state and USAID and others are finalizing.
So will it report the number of entities that are those organizations that are receiving assistance are doing business with? Will that be part of the report as well? Will we look at how they are being affected as well in terms of the impact of this policy?
we'll report those organizations that have chosen not to accept funding under those conditions, yes, if that's what you're asking.
Yes, and will it provide the impact of what that means in terms of lives and other health impacts from the failure to use that funding?
Well, the funding will be used. It will simply be used by other organizations. It will be transitioned to other organizations that are willing to accept funding under the conditions of PLGHA. So the funding, this actually doesn't reduce funding by $1. It does change the organizations that are willing to do that work subject to receive those funds.
Well, I look forward to the report.